It's my feel-good breakfast show.
This is your Feel Good Breakfast Show, Expresso. We're live on 3. Thanks for choosing us on this Wednesday morning. Now, this month we're celebrating Heart Awareness Month. Yes, we bring information and we're talking about the most important organ that we all can't live without. And what better person to bring to our studio than our vital expert, Andrea du Plessis, to talk about it. Welcome to the show, Andrea.
Thank you.
I want to get into it. I mean, why do South Africans have such a high risk when it comes to our hearts?
You know, heart disease worldwide is a big problem. It's the leading cause of death in the world. In South Africa, I think there are some significant factors, one being genetics. So some people have the genetic trend for high blood pressure, cholesterol, etc.
Right.
But also our lifestyle and our diets.
Oh.
So unfortunately, being inactive and being overweight increases one's risk for cardiovascular problems. And smoking, etc.
And etc. and all the bad stuff. You just mentioned something. You said cardiovascular. What are the most common heart problems and how do we avoid them?
Well, common heart problems include probably the most common high blood pressure. Most important thing there is they call it the silent killer because you wouldn't necessarily feel the symptoms. So it's very important for anybody to know what their blood pressure is, especially if you're from a family where there's a history of heart disease, because then there's a possibility for a genetic risk. And then cholesterol, the other one, also a silent killer because you don't feel the symptoms of having high cholesterol. So that's also something that you can have tested. And as soon as you know whether your cholesterol is high or low, you can do something about it if it's high.
Earlier you mentioned diet is one of the most important things. And I think of my own family, you know, we for vegetables we have chicken. You know, that's how
I don't believe that.
That's how we love meat. How exactly can eating decrease your risk of heart disease? What should I eat for optimal health?
You know what? Eating meat is not so bad. I think it's making sure that we also include the healthy foods that can lower the risk for heart disease, that can help lower cholesterol and is beneficial for blood pressure. So I'm thinking of nuts, fish, fresh produce, you know, vegetables, fruits, etc. The healthy oils, olive oil, avocado. I mean, years ago, doctors thought that those things were bad for our cholesterol. Now they know it's good. So, yes.
Which is a good thing. How do I know if I have a heart problem and what should I do if I suspect I have one?
Like we said, we don't always know, especially considering heart cholesterol and high blood pressure. So the first thing you do is have those tested. And if you suspect you've got a heart problem because you've got chest pains or whatever, then go to the doctor. Always ask the doctor first.
Always ask the doctor first. Now, we also have our vital expert who also answers our questions on the show. And it seems like we have some Facebook questions. This one came from Joy Victoria. She says, hi, Andrea. My mom is on chronic medication. I think it's called simvastatin. 10 milligrams, she says. She wanted to know if she could take omega-3.
Now, if you take simvastatin, it's a cholesterol-lowering medication.
Right.
So that's good. Obviously, it helps lower the cholesterol and reduces heart disease risk. And she's asking if her mom can take omega-3 as well. Absolutely. Just because you're taking the medication to lower cholesterol doesn't mean you can't include those healthy oils like the omega-3. So the vital omega-3 concentrate is probably the best one for her to take. Okay. But what made me want to answer this question today is if her mom is taking the statin medication to low cholesterol, it's great because it's beneficial, but it has an unintended consequence. And one of the side effects of statin medicine is that it lowers the coenzyme Q10 in your body. Now, coenzyme Q10 is a nutrient which is really important for a healthy heart. So even though the cholesterol medication sorts out the cholesterol,
it affects the other stuff.
That's right.
Okay.
So it's even more important for her mom to take coenzyme Q10 in a supplement to replenish the nutrients lost from her body due to the medication.
And to also have a healthy diet. Did you hear? Nice nuts and fish and avocado and olive oil. See, I'm taking notes. I'm mentioning this so that my family can hear that you don't have to have chicken as a side dish. You know, so that we can include those vegetables as well. But we're talking heart awareness. Eat healthily. You can dramatically lower your cholesterol. You don't have to develop a heart disease. Use this Heart Awareness Month as an opportunity to also take up that challenge and to make sure that you take after your health. See, we can't live without our hearts. What if you have a heart problem because you're in love?
That's a good problem.
Oh, it sounds so nice, eh? Thank you, Andrea, for joining us on our Feel Good Breakfast Show. There's lots more happening on your Feel Good Breakfast Show. More after this.
Make abuse a thing of the past. Nominate an organization that fights abuse. so they can win 35,000 Rand from the Vital Awards.